While muscular dystrophy remains a condition many are not aware of in Uganda, affected families face significant financial and emotional burdens as they grapple with this degenerative muscle disease. A physician at CORSU Hospital and also a patient, Dr. Birungi Deus Dedit, knows the struggle firsthand. He recalls being a vulnerable child, often unable to keep up with his peers or participate in age-appropriate activities. When symptoms began showing at the age of 5, they were misdiagnosed as polio, a common occurrence due to low awareness of the condition.
No, most of the time we would go, they would tell us, when they say this is polio, then they give you some medicines, and then they think this is going, but it's not going to go away. And then we began noticing that the condition was progressive, like I say, increasingly, some things I would not be able to do.
It wasn't until he turned 18 and was in secondary school that Dr. Birungi received an accurate diagnosis. Duchenne muscular dystrophy, one of the most severe forms of the condition. DMD is part of a group of inherited genetic disorders that gradually weaken the muscles, leading to increasing levels of disability.
Have any particular cure for this kind of condition? Because the cure means that you do not treat the muscle, but treat the gene. So most of the gene therapies that we could have done or could do, most of them are still under development. And for this part of the world where we are, there's not much you can do in terms of gene therapy.
The diagnosis made at Nsambia Hospital fueled Dr. Birungi's passion to study medicine, driven by a desire to better understand the condition that was changing his life.
I just settled my mind. I'm like, okay, right now, I know I have muscle dystrophy. That's it. So let me see how I can maybe go to medical school and do all these things and get out of it. And then, once I'm out, then I'll have the luxury to say, let me know what exactly it is, so that I know now with the information I have from school, I can use it to now help me, because I know I'm not the only one.
Duchenne muscular dystrophy is the most common and severe form of muscular dystrophy. It is caused by mutations in the gene responsible for producing dystrophin, a protein essential for muscle strength. Without proper management, most patients lose their ability to walk by age 12, and many face a shortened lifespan, often passing between 18 and 25 years due to respiratory failure. However, rare cases have seen patients live into their 60s.
Usually what we see around 12 years, 11, 12 years, most of them, if there is no management or treatment of sorts, they fail to walk. Most of them are unable to walk by that time. And then so they are wheelchair bound, they are dependent on the wheelchair, and then as time goes, more other things come in. And more or less in 19 years, 20 years, we lose them.
Families of affected children often struggle financially with diagnosis and access to specialized treatment out of reach. Assistive devices critical for maintaining mobility and respiratory function remain prohibitively expensive for many. To support these patients, CORSU Hospital operates a specialized Duchenne ward in Entebbe, offering comprehensive care and physiotherapy aimed at slowing the disease's progression. Still, many Ugandans, especially in hard-to-reach areas, cannot access these services due to distance and cost. Globally, advancements in gene therapy and drug trials offer hope, but to date, there is no known cure for Duchenne muscular dystrophy.